Hello and welcome back to the Virtual PT Institute, or VPTI as I like to call it for short. We've talked about a couple of different things so far on the channel, mainly centered on back pain, because it's a huge topic. It's a huge thing that plagues many people, both in our country and around the world. And so you've probably heard me in the previous videos mention my course, Take Back Your Back. Today I wanted to kind of step back and give you a little bit about me and what this course is all about. I've been a physical therapist for 12 years now, and I've been doing that at an academic teaching hospital in the Southeast. And so we try to be on the cutting edge of all of the newest research coming out that deals with physical therapy and movement and different pain problems, particularly in back pain. And I've done extensive continuing education and how to treat and how to manage low back pain by achieving some different certifications and taking some additional exams beyond just the graduate exams and the licensing exam for physical therapy in my state. And so with all of that, I've worked with hundreds and hundreds, if not thousands of patients over my career so far, and many of those are dealing with low back pain. Probably the majority are dealing with low back pain, and that's why I took the time to really try to develop my skill and my clinical reasoning in that area, because it's just such a problem in our society today, and everyone will deal with it at some point, but we want to be able to handle that and learn about that, and also communicate all of those things to you, the patient, so that you have good understanding on how to manage these problems. So that's a little bit about me, and so I come back to this channel with some expertise. I'm not just trying to create something to get clicks or to get downloads, but I genuinely have an invested interest in this because I care about patients. I want them to be able to do what they want to do, and I've been doing that for the entirety of my career. So what was the catalyst then to make this course? Because I'm obviously treating patients in clinic day after day, but the idea for the course came from just everybody was just asking me so many questions about different things, about how we move, about things to help it feel better. Why do I experience this? Or, hey, you're a physical therapist. Hey, I've been dealing with this. Can you help me here? And so because of all those questions, I was like, well, it sounds like there's really a missing piece of the puzzle, I guess, in our patient education out to the populace to help manage these back pain problems. And so I kind of took that on, and I was like, I instruct all my patients in certain things to help them get feeling better. So why don't I take the effort to educate you, and treat you like you'd be my patient? And that's really what this course is about. It's about educating you, teaching you the fundamentals of mechanics, of movement, of pain science, and types of different exercises. On this channel before, we've talked about better success with back pain means if you can group or categorize your back pain, you can have better success. And so this course is really designed for you to come alongside me, almost as if you were a patient in my clinic that I was evaluating. It goes through many, if not more, information than I would actually give in my evaluation with the patient, because I've got the time and the platform to do that. I wanted to try to make it personal and effective for you. So today, what I want to do on this channel, rather than talking about a subject, is just kind of give you a little sneak peek about the course and a little bit about the objectives and the different modules that are in the course, Take Back Your Back. I think that'll be helpful, because as you're thinking about this, and we've talked before, there's so many things pulling in different directions, like where do I go? I'm dealing with back pain. What's the best method for me to get better? What exercises do I do? Are there supplements? All of those questions come into play. And I thought it'd be helpful for you to see kind of a sneak peek of the direction of this course and take a look at the different topics that we cover in this course to help you start to manage your own back pain. So I'm gonna give you a little clip of the very beginning that outlines everything we talk about, so that gives you a better idea of, hey, is this right for me? I really do believe it will help many folks, but you should be able to understand what you're getting into. And so take a look at this little clip about the objectives and the different modules that you'll be discussing and how to go through that, and then we'll come right back after this little clip. So let's look at some of these objectives together. The first objective we're going to look at is just observing some of the revealing statistics that are involved with low back pain. Some of the numbers are pretty staggering, and you might be thinking, I don't want to spend time going through the numbers and looking at all the percentages and all this kind of stuff. But I have a very specific reason as to why I want you to go through that part of the course, because it's going to give you some clear understanding and some really good confidence to get through this back pain problem you're experiencing. And so those numbers are important because they help us understand the problem in a greater detail. And through that, I think you'll be very encouraged with that. One of the other objectives we really want to look at is understanding a lot of the basic anatomy, the posture of the spine, understanding the mechanics. That's just a fancy word for how the spine moves, how all these tissues move when you do an activity or when you do an action. And through that also, we want to understand and learn some of the fundamentals of tissue healing, right? You've downloaded this course because you've been dealing with some back pain. Maybe it's on or off. Maybe you had a recent injury. But the tissue can heal and the back can heal. And it's important to understand that tissue healing process as it relates to back pain so that you know kind of what to do based on what phase you're in. If it just happened, you're going to do different things to help your back heal. If it's been there for a while, you're going to do different things to help your back heal and get better. And so understanding the foundations of the anatomy, the different muscle groups, and how all of those things are affected by movement and force is really important to understanding and gaining those fundamentals to managing your back pain. Along with that, we want to recognize just some of the pain science concepts. This is kind of a developing field of study, but it's really important actually. And we want to understand how these pain science concepts can affect our low back pain. And so this gets at maybe some of you guys have experienced an injury or a back pain problem, and it just didn't seem to go back to normal. Maybe those nerves have stayed excited, and now things that didn't used to be painful have become painful, and it's really limited your daily function. It's affected your social relationships. And this part of the module, I'm going to give you kind of a brief understanding of what's going on with the nerves, how those pain signals can be affected by different things, all in an effort to help you understand, again, that we can manage this, okay? And that you have better understanding of kind of that neural process at a foundational level. We're not going to get really in depth with neuroanatomy and things like that, but really a functional level. And I've got a great resource in that section that I encourage you to look at from Dr. Adrian Lowe, who's done some great work with pain science and has written some great resources that I'm going to make you aware of to delve into that a bit further. But I'll be highlighting some of the main topics of that, again, just so you have better understanding of maybe things didn't heal quite right for you, and it just seems like this pain is lingering. And that module will cover that for you, and I think you'll find some good benefit with that. We also want to look, as we go through all that foundational lesson of the statistics and the anatomy and the mechanics and the pain science, well, we got to put all that together. And that's the main reason you are taking this course is like, okay, what do I do with all that information? My back hurts. What can I do? So one of the other objectives here, and this is the fourth objective, is to help you understand how to do kind of a self-movement exam. Are there certain things that make you feel better, make you feel worse? Are there certain positions or stretches that make you feel better or feel worse? And then helping you identify the things to avoid to help you heal when you think about that tissue healing process. And also identifying the things that you can do to help you feel better, and then also the things to prevent this from happening in the future. And with that comes the other main part of this course, which is going to be, we want to practice and implement the common exercises that can help prevent and manage your back pain. So there are things that can help. If you're sore, you had an acute injury, something that just happened, there's things you can do to help the body through that healing process. If it's been a couple of weeks and you're still dealing with pain, again, there's things you can do to help with that. And I'm going to teach you those things and show you those things and kind of instruct you how to do those things well. But the other piece of that objective is really important as well, and that's the fact that we want to teach you how to prevent things. And that goes back to, the positions you're in throughout your day. Do you sit at a desk job? Can we fix your sitting posture? Can we get you in a better position so that force is more easily distributed while you're sitting? Lifting technique. I mean, how many of us have thrown out our back because we've been lifting something heavy? right? You can count me in that. I've done that too. And a lot of these things I'm going to teach you, these prevention techniques and actually the exercises that help reduce back pain, I do them myself to keep my back healthy. So we'll look at prevention and ways to manage that from an exercise and movement standpoint. And then lastly, which is really important, is the fact that there are some really critical issues to look for if you're dealing with back pain. I don't want to overlook those. As you can see, we cover a lot of topics in this course, and that was very intentional on my part. I wanted to make this course as comprehensive as possible because I really do believe that if you can begin to understand and know about the foundational elements in back pain that are the most critical things, that through that knowledge you're then empowered to help yourself start to get better and start to feel better and move on into your daily function and get back to doing the things that you love. So again, I encourage you, if you're dealing with back pain, check out this course. I really think it'll be beneficial to you. And we'll see you next time on the Virtual PT Institute.